We had 146 new positive cases for a total of 2,141 positive cases. We've had no new counties added today, so the total remains at 82 counties. We had 660 negative cases today for a total of 8,534 negative cases. The State Hygienic Lab has 2,588 tests available. 987 Iowans have recovered for a recovery rate of 46%. I am so sorry to report that we have had 7 additional deaths in the state of Iowa, and that brings our total deaths to 60. And again, 49% of all deaths in Iowa are among residents from long-term care facilities. Across all of our RMCC regions yesterday, there were 175 COVID-19 patients hospitalized. 24 were admitted in the last 24 hours. 84 patients are being treated in ICUs, and 48 are on ventilators. Also in hospitals across the region, there are 4,072 inpatient beds, 396 ICU beds, and 694 ventilators that are available for patient care. And again, I just want to remind our listeners that for more information, including a breakdown of data by each of the individual regions or by county, to go to coronavirus.iowa.gov. Today, the Department of Public Health also has confirmed another 2 outbreaks in long-term care facilities. Lynn Manor Care Center in Lynn County and Lutheran Living Senior Campus in Muscatine County, and that brings our total of long-term care outbreaks to 9. We are continuing to monitor increased activity in long-term care and food production facilities in some areas of our state. And because we have been ramping up our testing capacity over the last few weeks, we now have the ability to conduct targeted surveillance testing in these facilities. Yesterday, as I had indicated, we sent an additional 900 tests to the Tyson plant in Louisa County, and today 15,000 tests will be sent to another Tyson plant in Blackhawk County where another outbreak is suspected. Additional tests are also being sent to long-term care facilities in Bremer, Muscatine, Johnson, Dubuque, and Lynn counties. Increased testing at this time is critical to not only targeting virus activity and identifying potential risk, but also in implementing specific measures to slow the spread within a facility, business, or community. And also it's going to be critical in making decisions to reopen up our state. In the coming days, we will be launching a new opportunity for Iowa, and it's called Test Iowa. It is an initiative that will enable us to conduct large-scale testing and contact tracing across the state. Test Iowa will allow us to ramp up our capacity to over 3,000 tests per day in addition to the testing capacity that we currently have. We're working on the operational plan now to deploy testing, and I look forward to sharing more details about Test Iowa next week. We are also preparing to begin serology testing. We have 2 labs in the state that will run the tests, and as soon as the supplies or the reagents arrive, they'll be ready to go. And that is the antibody test that will tell if you've already had and recovered from COVID-19. Again, and that will be just an important factor in making informed decisions about how we target our response and, again, reopen the state of Iowa. Our ability to provide more testing will allow us to capture more data about the virus and better understand its activity in Iowa. The more that we know about COVID-19, the better we can manage it until a vaccine is available. I've also asked, and the Department of Public Health has activated additional response teams dedicated to testing, contact tracing, and prevention. Dedicated strike teams will be deployed to long-term care facilities and large businesses where outbreaks are occurring or anticipated. And these teams of nurses will conduct surveillance testing among long-term care residents and staff or employees at large manufacturing, production, or other business facilities to, again, identify, isolate, and slow the spread of the virus in these environments. We are significantly increasing the number of nurses and other healthcare professionals that will be conducting contact tracing or surveillance to really help augment the great work that our local public health officials have been doing. In addition to identifying potential exposure among residents in a community, they'll also be able to conduct follow-up and recovery assessments for each positive case. And finally, the Department of Public Health has also put together prevention teams that will conduct outreach to large businesses and law enforcement to review guidance for preventing and detecting outbreaks and provide education on what to do and if an outbreak is identified. And this approach will intentionally target areas of most concern across the state. As I have said from the start, I am committed to making data-driven decisions regarding our response to COVID-19 in Iowa. And today the data tells us that Region 6 has elevated to a level 10. And this is due in large part to the long-term care facility outbreaks, the severity of the illness, and the rate of hospitalization. But it also takes into account the increase of virus activity in that area of the state. By using regional data, we're able to recognize trends and adjust our mitigation efforts to more effectively address specific measures to slow the spread of the virus in a defined area. So today, based on the ranking, we are implementing additional mitigation steps in Region 6. Effective at 11:59 p.m. tonight, in all Region 6 counties, all gatherings for social, community, recreational, leisure, or sporting activities will cease through April 30th. You may gather only with members of your immediate household. Limited exceptions will be made for weddings, funerals, and other religious gatherings, which will continue to be restricted to 10 people or less. Individuals are also required to make every reasonable effort to stay at least 6 feet away from others when they are away from home. Businesses are encouraged to follow guidance provided by the Iowa Department of Public Health regarding infection prevention measures to protect employees and customers. And of course, residents of Region 6 and all other Iowans should take personal responsibility for their health and the health of others by staying home as much as possible, leaving only for essential errands, work from home if you can. If you can't, then make sure you're practicing good hygiene practices and practicing social distance as much as possible. Isolate at home if you or a member of your household is sick, and if you need medical attention, please call the doctor first. COVID-19 is now part of our life, but it will not always dictate how we live. We will continue to monitor the data and adjust our mitigation strategies as necessary, as we're doing today in Region 6. But I believe that before long, we will see more signs of progress, and we will begin to get life back to normal. So as we're maybe dialing down a little bit today in Region 6, we're also looking for opportunities and criteria and metrics that will allow us, when we can do it responsibly, to start to dial things up as well. So if you continue to do your part, we're going to be talking about that sooner rather than later. As we've said all along, we're all in this together, and we're going to get through it together as well. So in closing, I want to thank a friend of mine, and that's Ashton Kutcher, for his help to encourage Iowans to stay home during this critical time, to protect their health and the health of others. And I want to share the PSA that we will be releasing today, and I want to thank, again, Ashton Kutcher for his help in making that happen.
In Iowa, home is everything. Our family, our history, our hopes, and now more than ever, our health. Because staying at home is how we stop the spread of coronavirus. And staying at home helps our first responders and healthcare professionals who are on the front lines of protecting us all. The coronavirus has changed a lot of things, but one thing can't change is how Iowans pull together to do the right thing. So stay home if you can. It means everything.
And with that, we'll open it up for questions.
We understand that there may be an outbreak in the making at the Waterloo meatpacking plant.
Yep.
And my questions are, have you been asked to close the plant? And is OSHA or any other state agency that's responsible for ensuring the protection of the workers stepping in or stepping up their activity in these types of plants to ensure that not only is the meat safe, but the workers are safe as well.
Yeah. Well, the food safety is inspected by USDA often and regularly. And so yesterday I had referenced the Iowa Department of Ag. They play a role in smaller inspections, but any of the national or the larger facilities that export is done by USDA, and that's done often. We have talked with the plant in Black Hawk County. We're sending 1,500 tests there today to start the testing for the facility. So again, we can identify those that are sick and those that aren't, so we can start to understand what the scope of the outbreak may be and to get in front of that. So we're working with the plant and the management and making sure that we're implementing that. And we continue. I talked about the prevention and protection teams also with public health, getting into these facilities and really walking through and helping educate not only the facility on what they can be doing, and they have been very proactive, but also, working with the workforce so that they know what they can do to really help mitigate and slow the spread as well. So we're working very closely with the facility, and we'll continue to do that with all of our food processing and packaging plants. It's an essential infrastructure. It is part of our food supply. We have to make sure that we're protecting the employees. So that is always first and foremost, and that they know that because that's how they keep the facility up and going. So they have a vested interest in making sure that they're taking care of their workforce. But as we start to shut more and more of these processing plants down, then it backs up, and there's other severe consequences that also are a result of that. So we have to be doing both at the same time, and that's why I'm so excited about Test Iowa and being able to bring additional testing into the state to start to do some of that surveillance, to really to help, because we're doing more testing, to really help provide public health to augment their team and provide additional nurses and resources to do that surveillance and that contact tracing so we can understand the scope and really start to get in front of some of these outbreaks. And so, and by educating, by preventing and giving them the information that they need.
Governor, how will the state hold employers accountable if people get sick at their business and it turns out that they haven't been following state and OSHA guidelines for keeping people safe?
I think employers are doing the right thing. They need to continue to do the right thing. We're going to continue to work with them and be a partner. As I said just a few minutes ago, we are all in this together. And we want to make sure individuals need to take individual responsibility. Like, I can't monitor every single person across the state. We have to put in place some guidelines. We have to encourage and educate and start to put some mitigation efforts in place to limit social gatherings, to shut down some businesses where people start to gather more than they should, to help slow the spread, to make sure that we're protecting those most vulnerable, to make sure that we're not overwhelming our healthcare system, to make sure that we're protecting our healthcare and first responders and our food supply chain. And then, and just saying over and over again, if you're sick, stay home. Don't leave if you don't have to. So we need to be a partner with Iowans, and we need to be a partner with businesses and providing them the information they need. As I reach out and talk to these businesses, especially some of our larger companies, we ask, do you have everything you need? What are you doing to help protect the employees? And they have a vested interest also in taking care of their workforce to make sure that they can continue to be up and running. So it's a partnership, and we're going to continue to work together, and we're going to get through this, and we're going to slow it, and then we're going to use data and metrics, and hopefully if everybody does their part, then we're going to start talking about how we can responsibly start to open back up the state.
As you say, you're talking to the, employers. Have you talked to any of the workers? Because, reporters are hearing from people who don't feel safe at work, even at some of these places that, the state is working with.
Yeah, so that's a part of educating. You heard me say not just the employers, but the employees as well. Getting into these long-term care facilities and make sure that we're talking to the individuals that are working with the residents to make sure that the employees that are at these businesses know what they should be doing and how they can start to isolate themselves if they're sick. If a family member is sick, then they need to stay home. From the very beginning, I have said to employers, it is so important that your employees know that if they are sick, they should stay home. And that's how we start to slow the spread, mitigate the impact that this will have on elderly Iowans, our healthcare systems, our frontline workers, and by doing that, then again, we can start to change the narrative and we can get through this and start to open up.
With the new Test Iowa, the contact tracing you're talking about, how many people are you adding? And also, what is the state doing specifically for contact tracing in places like Louisa County, some of these places where there's a lot of large immigrant populations, maybe people who don't speak English? Is the state hiring interpreters as part of those teams?
Well, maybe I should. They are, and I want to, local public health has been doing yeoman's work in getting this done. But as we ramp up testing, we need to bring new people on, and we are going to significantly increase the number of individuals that will be doing the contact tracing. One of the agencies that we'll be utilizing is the Department of Human Services, who has existing state employees that we will redirect and reallocate what they are doing to help do some of that follow-up and contact. So we'll have some of that that's happening too, and then I'll have you talk about other resources. I don't know which way to go with that, but okay.
No, thank you. I appreciate the question. The Iowa Department of Public Health, and I think I'll have an opportunity to talk more about, what we're doing from a health equity perspective to be able to reach various populations throughout our state. And so we do have people both at the local public health level as well as at the State Department that have the ability to speak more than one language. And in addition to that, we have access to translation services. So we will be looking at all of those things so that we can make sure that we are able to connect with people who have been identified as positive cases, to be able to talk to them and give them guidance about how to keep themselves healthy so that they can get back to work as we know that they want to do.
Monica, go ahead.
Thanks. Governor, it sounds like the biggest change for Region 6 is those limited gatherings for household members only. My question is, what about businesses? What kind of changes are you considering, if any, where there might be more of an impact if there's crowds, not crowds, but more people?
So it does. It's just basically gone from gatherings of 10 or fewer to really limiting to a household, except for the few very narrow exceptions that we laid out. And those were already in place and had already been narrowed down. And it requires everyone in the order to do everything absolutely possible to social distance, at least to stay 6 feet apart. I would remind Iowans that if you're not able to do that, or you're in a place where you're concerned that you can't social distance, have a mask and put that on if you have that available. I think we've talked about that as well. And then again, just reiterating to employers to make every opportunity available to telework if you can, and if not, to take all precautions for in-place operations to help protect the health and the safety of your workforce, and again, help prevent the spread of COVID-19 in the facility.
We're going to let Nick at the Des Moines Register. Go ahead.
Yeah, Governor, I was hoping you could elaborate more on the exemptions for the Region 6 order, and does it include shutting down any additional businesses?
Yeah. So as we've said all along, a large percentage of Iowa is an essential workforce. It's almost 80%. And so right now, as we do more testing and we learn more every day, if we're able to bring the serology testing on board and we're able to do the surveillance by testing more Iowans, we'll have a better idea of where some of the hot spots are that will really allow us to really target the responses that we put in place. And so we've taken the next step. But in addition to that, so it's not just the additional requirements. I hope you heard at the beginning a lot of the other things that we're doing that I think also will be extremely impactful is the additional testing, the additional surveillance, the additional strike teams that we're putting in place with nurses, and just the opportunity to educate not only business facilities but long-term care facilities as well, and then the prevention team that's actually going to go out and work with law enforcement and again some of our businesses to say, here are the things that you can do that we recommend that you should be doing to protect the business and your employees. And so more of a one-on-one with a team of dedicated individuals that will really go to the areas that we need them. So that's a big component of what we're doing too. We didn't have the capacity to do that before, and with Test Iowa and some of the other things that we're bringing on board and some of the other enhancements that the Department of Public Health have put in place, I think collectively we'll be able to to tighten it down a little bit more. We're going to continue to reevaluate. But the other thing that potentially could happen is we do more testing, the numbers will fluctuate as you've seen them fluctuate over the last several days. Do you have anything to add to that?
Thank you, Governor, and thank you for the question. I think I would just reiterate, again, all along what we're trying to do are take into account the information we're getting here in Iowa, the information we learn about this virus across the world and across the country, and our commitment remains to help protect and improve the health of Iowans. And so we want to continue to do everything we can to stop the spread of this virus, to optimize the outcomes for people who are going to be most at risk, and to share information as quickly as we possibly can through things like our new dashboard and webpage. And so the resources that you've heard about, not just changes in sort of assessments and scores, but also the resources and the ability to provide directed interventions to places where we hear about their concerns, whether we're hearing about it from the individuals that we interview through public health or through the clinicians that we work with very closely. Those are all important things that we continue to take into consideration as we use information to help make the best choices for Iowans, to help us in understanding how to limit the spread of this virus based on how we live and work and interact.
Todd at KCCI, go ahead.
Governor, you mentioned with this new testing program, you're trying to do 3,000 tests a day. Is there, if you could wave a magic wand, how many tests do you think it's going to take to get to a point where we know, have a better idea of what's happening in the state?
Yeah, and we'll have the capacity to ramp up to that. We're not going to be able to do that on day one, but we will have the availability to do that. But as you just heard Dr. Badati say, and I'll bring her back, that's one component, so it's not everything, but it is a component, I think, of allowing us to make the targeted decisions that we need to make and get the people and the information to the areas that most need it.
Yeah, again, I think I would say, as you've heard, I think we recognize the challenges and limitations around testing, and every day we continue to work to try and expand that and focus those resources, again, to help stop the spread of the virus and help the people who we know are most at risk. I think the other thing to keep in mind is that there's still some learning we're doing about COVID-19 or the virus itself. And so what we're trying to understand, for example, are things like, as you heard the governor say, for people who have had this, what does that immunity mean? And we also look to try and understand from lessons in prior pandemics, like H1N1, for example, is this the type of illness that we kind of see once and it goes away? Is it the type of illness that we see and then it starts to go down and becomes more of a milder seasonal type illness? And so as we learn more about the virus, it's important to keep those things in mind, because I don't think it's about a single number or percentage of people who need to have a specific test. We're going to use all of the testing ability, whether it's a diagnostic test using PCR, a swab to figure out who's actively sick, or whether it's a serologic test to help us understand who might have been sick in the past and who might be immune now. We take all of that information into consideration, again, to help understand what we can do to make the best decisions for Iowans.
Rachel at Channel 5, go ahead.
Hi, Governor. We have a question from a viewer that is asking for guidance for Iowans that are looking for answers about their stimulus check, but they don't have access to the internet or a computer. So what is your guidance for them? And then also, this may be for Dr. Badati, but if you could explain just more about the antibody test. We're getting a lot of questions about what that really is, how it's helpful. So if you could just kind of explain the reasoning behind the importance of getting that test here in Iowa.
So how about we'll get the information for the stimulus checks. We'll post that on coronavirus.iowa.gov. And so that's probably the best way that I can help get that information to all Iowans. So, and then I suppose we'll get a number too that we can call, and we'll get that back to you so that if they can call the hotline number, I guess, and get that at the Capitol and hopefully get some answers for that too. But we'll try to get that information up on coronavirus.iowa.gov.
Yeah, thank you for the question. So when we talk about immunity, right, there's a couple of different terms or phrases that we can use. And so you have a system in your body, right, that learns how to fight off different things, whether it's a bacteria or a virus. And you have a particular type of blood cell that learns how to do this, and it produces antibodies to help you fight infections. Now, some of the antibodies it produces, it does that very quickly, and it can do it in certain parts of the body, like in the blood or in the mucous membranes. Other types of the antibodies that are produced come a little bit later. They tend to come maybe 2 to 4 weeks later, and those give you what we call more of a memory or lasting immune response. And that's important because there are some illnesses where if you can teach your immune system how to fight something, it can remember how to do it again in the future. And that's exactly what we base vaccines on. So that's why you hear me say in the fall, you want to plan your flu vaccine about 2 to 4 weeks before flu activity. So the idea of being able to understand who might have had a recent infection or an infection a couple of weeks ago helps us start to understand who might be immune to this virus. Now, again, I have to say there's some things we still don't know about the virus. We're still learning about how long that immunity lasts and what it means. But it's an important thing for us to understand when we think about people in the population who might still be susceptible. And so it, again, helps us understand what decisions we can make that are data-driven to help all Iowans get back to normal life.
We're going to go to Clark Hoffman, Iowa Capitol Dispatch.
Thank you, Governor. Can you tell me who in state government is investigating complaints from Iowa workers who say they're being forced to work while sick? And separately, are you saying that the USDA and Iowa Department of Agriculture are actually inspecting food plants for adherence to these proactive self-imposed mitigation efforts?
They do that all the time. That USDA inspects the food processing plants across the state. And when yesterday or whenever I think I referenced the Secretary of Ag, they do the smaller facilities and not the larger ones that export products outside of the Iowa and outside of the country. So USDA is the one that does the inspections for those. And that is done all the time and regularly. Oftentimes they have an USDA official that's on site at the facility.
We're going to go ahead to Caroline at Sinclair.
Good morning, Governor. Twofold question here. One, if your state assessment document is reaching a 10 or greater threshold shelter in place, why aren't you using that terminology in describing what this order is? And second, in a memo that you sent to lawmakers in that region, you talk about how this doesn't apply to Iowans leaving their homes for employment and that businesses are encouraged to follow guidance, which includes if you are required to work at a physical location, practice social distancing, careful hygiene. So if some of these businesses would be exempt, so essential businesses, you might say food packing, manufacturing, how do they practice social distancing in that environment anyway, and what are you guys doing to address that?
I'm not sure which one of those questions to answer. So let's see. So we are, so as far as the additional metrics that we put in place, I've said all along, we're going to dial it up, we're going to dial it down. So we're dialing it down a little bit more. We're going to a household and we're talking about additional measures that they can take with very few exceptions. But as I said a few minutes ago, we're also implementing many other factors that can help us really review some of the areas by doing more testing, by doing more surveillance, by putting the strike teams in place, by dialing down the metrics just a little bit more until we can start to analyze and see what the impact of the increase in the virus has been. Right now, a large percentage of that has been tied to our long-term care facilities as well as some of our food packaging and packing plants. And so we know that's where we're experiencing some of the potential outbreaks, and so we are getting the testing there and doing the surveillance so we can get some sense of what that scope looks like. In addition to that, we are working with the businesses to make sure that they're implementing safe and good practices, practicing as much social distancing as they can. That's not always something that they're able to do, but if they can't, many of them are putting in plastic shields between the employees. They're implementing the wearing of masks, and not only masks, but face shields. They are doing screening when their when their employees come to work to see if they show any signs or if they have a fever. And if they do, they're sending them home, in addition to asking them, who else have they been in contact, so that we can maybe get in front of that as well. So it's constantly working with our larger businesses, especially some of this essential workforce where we know it's incredibly important that we're taking care of the employees while working with the employers to make sure that they're implementing safe practices, disinfecting more often, face shields, face masks, screenings, making sure the employees know that if they're sick, they need to stay home. It's really important that they do that. And so we'll continue to work with the employees and the employers to make sure that they have the information they need.
We're going to have time for just one more question. And so, Rod at the Gazette, go ahead.
Yeah, thank you, Governor. 2 days ago, President Trump said he would speak in the coming days with all 50 governors to discuss how to reopen the economy. Have you spoken with the president about plans to reopen Iowa's economy? And if so, what were some of the details and expected timelines that you envision? And did the president indicate he would authorize Iowa to implement that approach, or give any indication what his expectations are for opening things back up? And if you haven't yet, what do you plan to tell him?
So that call is today. So I think all governors are getting on a call with the president today, so he can outline some of what he's thinking and maybe what he's looking at for metrics as far as opening up states across the country. We're going to continue to, work on that from a state perspective as well. A lot of times the decisions that we make and the metrics that we put in place have aligned with CDC, so there, typically there could potentially be some overlap, but we look forward to continuing to work with the administration and to work with the Department of Public Health and really the metrics that we have in place here in the state of Iowa to figure out ways that we can start to dial this economy back up and get Iowans back to work. So I'm looking forward to the call. I don't have, I'm not sure what, all is going to be covered, but we're going to find out today. So maybe I can report on that tomorrow.
Thanks, everyone.
Thank you.